fun-filled afternoon for you. My name is Tassine, and I'm one of the staff members. And tonight we are going to enjoy a wonderful meal. What we're going to be eating tonight is called Nepali red lentil soup. We also have a cabbage soup, a cabbage slaw, and we also have broccoli for you, and we have the famous all-time happy cookies, one of my favorites. Tonight we're going to have a special treat by Dr. Ben Pruitt. He is going to be talking on natural ways of treating peripheral artery disease. Okay, hope and pray you enjoy tonight. Before we begin, why don't we have a word of prayer? Let's wait until everybody gets settled. I know everybody's hungry. The smell of the food is making me hungry. Really, really hungry. All right, everybody ready for prayer? Let us pray. Our Father, we thank you for this time we can spend getting to know more about our bodies, more about healthy, nutritious foods. Bless our food tonight, bless our fellowship, and help us to learn more about how to take care of our bodies. And we thank you that you care about everything that concerns us. In Jesus' name we pray. Amen. All right. All right, tonight, why don't we get started with our demo tonight. Corey is going to demo for us how to make this wonderful soup. Corey, thank you for being here tonight. It is indeed a blessing that you're here. Did everyone have a good day today? Very good. Very good. All right. How many of you like Indian food? Yes, I do. I do. Anyone have any questions tonight? While we wait for our guest speaker. We have one here. We'll get you. Anyone have any concerns, any questions tonight? Okay. We have one right in the front. Someone in the front needs us. Okay, ready? All right.
I heard another child. My apartment is in the NITTAR ward. At my apartment. Coming over here.
Okay. All right. Tonight we're going to be demoing the red lentil dal soup, one of my favorites. And one of the main ingredients, we have the olive oil. How many of you know how to shop for olive oil? What would you look for when you want to buy the best olive oil? Go ahead.
Making sure it's green.
That's important, okay? Making sure it's green. Anything else? Bottles in California. Local is always best.
There's a local place down here.
Okay.
Yeah.
Very good. Make sure it's 100% olive oil. What about the cold press? Okay, it must be first cold pressed. That's the first press of the olive. That is indeed the very, very best. You're getting the freshest and the most potent form. And next we're using garlic. Also, we have garlic and onions. I love garlic, lots of garlic and lots of onions and green peppers. So various studies show that garlic can reduce the risk of stomach, prostate, and colon cancer. These are very prevalent in our community today. And lots of garlic. If you go to Italy and places like that, they eat lots and lots of garlic and onions. It's very good for you. The anti-tumor property of garlic is because of its organic sulfides. Studies in Greece show that a high consumption of onions and garlic and other herbs can prevent stomach cancer, a very progressive form of cancer. Another herb that we're using tonight is ginger. Dried ginger contains a rich amount of antioxidants, very much anti-inflammatory activity. Ginger is very good for inflammatory. It's a very good anti-inflammatory. Garlic is a natural antibiotic, right? And it helps to inhibit various cancers. Ginger also contains curcumin, which helps to eliminate cancer-causing substances in the body. Tonight, we're also using tomatoes. Use tomatoes as a major dietary source. It has lycopene, which is an antioxidant. Well, what are antioxidants good for? Does anyone know? They take care, our guest doctors says it takes care of free radicals. Also, we're using turmeric. There's a lot of studies out now on turmeric. What is turmeric good for? Turmeric is very good for inflammation. You can use it in your tofu to add color and also add flavor to your foods. Curcumin is what is found in turmeric. It's a very powerful antioxidant, more powerful than vitamin E. Curcumin has the ability to suppress the growth of certain cancers, such as stomach, breast, colon, lung, and skin cancers. So go ahead and add a little bit of turmeric in all of your dishes. It will never hurt. It will only help. Also tonight we're using cumin. Cumin may boost the immune system, and especially for cancer patients, the chemotherapy tends to break down the immune system. So it is vital that you build up your immune system to help you fight off diseases and various bacteria. Especially with flu season coming up, you want to pack in a lot of turmeric, a lot of cumin, anything that helps to build up your immune system. Okay, also we're using tonight coriander. Coriander's nutritive qualities come from the minerals, and it is considered a very good source of vitamin C, along with phosphorus, potassium, zinc, fiber, calcium, iron, and magnesium. So you definitely want to throw in some coriander in your meals. I like to put them in my cookies and my cereal. Coriander and cardamom. It makes an excellent substitute for cinnamon, which is an irritant, right? Okay, while Sukari is slaving away on a hot stove over there, we are using what we call dal, which is lentils that especially the Indians use a lot. A diet high in legumes provides a measure of protection against stomach and prostate cancer. Lentils in particular are high in fiber, complex carbohydrates, and it's low in fat and low in calories. If you're looking to lose weight, if you have trouble with constipation, you want a diet high in fiber and low in fat. Yes. the difference? Who can tell us the difference between red, besides the color? The flavor. And you know, God is so amazing. He has given us a rainbow of colors, and with every color comes a different nutrient. That's why when you eat, when you buy food in the grocery stores, you want to pack your cart with the rainbow of colors, because all of your nutrients come in different colors. So when you eat your green peppers or apples or anything, you want to get a variety of colors, the red, the green, all of the different ones. Okay, any other questions? So tonight we're also using flaxseed oil. This can be found, this one came from Whole Foods. You can get it at Trader Joe's or Sprouts, any of your local grocery stores. And this is rich in omega fatty acids. What else is this good for? Does anyone use flaxseed oil? Flaxseed, okay. Anybody else use flaxseed oil? Actually, Dr. Neil Nedley highly recommends this if you have any issues with depression or mood swings. This is omega fatty acid is excellent for the brain. Somebody had a question.
I heard that it's better to grind your own.
And that's the way I normally eat them. I grind my own. Very good. Flaxseed is very good. It's high in fiber. You don't have to worry about constipation at all. It's an anti-inflammatory as well. Okay. Also tonight we have the broccoli. The broccoli is a part of the cruciferous family. Along with the cabbage, the cauliflower, it helps to protect against colon cancer. Additionally, a higher consumption of cabbage has been shown to decrease the risk of stomach and colon cancer. These are all diseases that are prevalent today, and they can be prevented. God has put within the food all of the medicine. One philosopher once said, "Let food be your medicine, and let medicine be your food." If we give the body the correct environment, there's no reason we have to have all of these diseases. Is that? Okay, so with all of that talking, our soup is ready. Look how beautiful that is with all those colors. Now, some people, they prefer something more bland. They don't like spicy foods like myself. You don't have to put all of these spices in them if you don't like. You can just use, did we use salt tonight?
Yes, just sea salt, just a little bit.
We used sea salt. Himalayan, the pink Himalayan salt is absolutely the best, along with the Celtic salt. Is our guest speaker in? Okay. Do you have anything you want to say? Thank you, Sakari. And now, Deborah, are you ready for your presentation? Yeah, we're done. Were they already cooked? No, you have to cook them. They come dry, and then you cook them.
No, it wasn't cooked yet, it was still actually raw. Yeah, they're raw, you have to cook them raw. No, not quite yet, it was just a demo.
No, it takes a little longer. I usually put my beans, I normally put my beans in a crock pot and I cook them. You can cook them overnight, and the flavor is just amazing in the morning. You had a question? Okay, any other questions? And next you'll be having your happy cookies. I hope you will be happy ever after. I know I am. Okay, thank you very much, Sakari. And now we'll have Deborah with her natural remedy demo. You enjoyed that? Good. I'm so glad you did. It's called red lentil soup from Nepali. And Deborah, tell us what you will be demoing tonight, please.
Testing, can you hear me? Testing. Yeah, I can hear now. Good evening, everyone. How are you enjoying that lentil soup? Yeah, it was, when it was cooking, I was like, I can't wait. So, I know it's good. Okay, tonight we're gonna just do something simple. We're gonna be doing, oh no, hold up. I'm gonna let Tess, if she wants to, what did, say the name of it. Now, this is MSM. Who knows what MSM stands for? Brother Pete. I know, that's the problem I had when I said, okay, yeah. So we'll get, someone can come up, Brother Pete, for a minute. Anyway, this MSM is a source of sulfur. And the sulfur is from more or less from a plant-based, and it also is found in the women and the fertility part when she's having a baby. It's something to do with it. I didn't go into a whole lot of research on that, but it's found in the mothers.
Next time I'll know the name of this.
Is what.
Yeah, so you'll be coming.
Yeah, so you want to say it? Sure. Go ahead, go for it.
That was the final update.
Okay, that's like 4 or 5 words, that's too much for me, right? Anyway, but that's what it is, and it says here, now this is a supplement form. You can get it in a supplement form, or you can get, which is a powder or crystal, and it's really beneficial to you because it helps support and build up your connective tissue, okay? So when you take this, if you take it in water, or if you make it your, we're gonna make a gel tonight for pain. Now, how many know someone that have arthritis? How many know someone that has, maybe we have it when it gets colder, we find that we have some of this arthritis going on. So this is excellent for arthritis. And you're gonna make it, you can take it internal, or you can create you a gel. And just put it on the spot in which you're having your pain. Okay, thanks, brother. Okay, so first I was gonna do your magnesium first, but somehow my little container is walked away in the kitchen somewhere. I can't find it now. Yes, ma'am.
I just wanted to know, where did you get that one? Because the ones that I had before, they said they have something for animals. So
This one you can get at Sprouts, or you can get it at Christina's probably, but I got it at Sprouts. Okay, now it's hard also to find aloe vera. This is 97.7% pure. It is hard to find aloe vera gel that doesn't have the alcohol in it. So I got this at Walmart, Target, okay? So real quick. Now this is called Calm. It's natural calm. It's a a relaxing magnesium supplement. This also is a magnesium drink. You can just put a few scoops in maybe you have juice or whatever. You can take it to work, and when you're feeling like you're just really depleted or you need some energy, you know? And also this will boost your energy as well, the MSM. Okay, so real quick, we're gonna create right now, we wanna do something for pain. Oh, you know what? Could one of you bring me a bowl, please, a glass bowl, please? I have to water it. So anyway, we're gonna take a few scoops of this and we're gonna use our aloe vera gel. Aloe vera is very good for the skin. Most people know that. It's very good for the skin. And it soothes it and you get comfort with it. And if you're creating some kind of a natural remedy where maybe you want to use essential oil, it's good to always dilute this essential oil with some carry oil or something like aloe vera gel. Okay. So as soon as I get the bowl, we are. Now this is one that's already made. Once you create yours, you can bottle it up and put your cute little thing on it, a label and date it, but this will last until you use it up, probably, you know. Okay, thank you so much. Okay, I'm just going to pour a little of this in here. This is the aloe vera gel. I could have just squeezed it into my bottle, actually. I have a little squeezy tip here. That'll save me some time. So we're just gonna squeeze some in. I'm gonna do it here where you can see it. Okay, it's a little more than half. So now I'm going to add my crystals into this gel. You can put about 3 or 4 of these scoops. The scoop comes in the container itself. So to save time, that's a good thing. Okay. Okay, I have now I wish I had I'll stir it with this. And you're just gonna stir it into the gel. To get it in there good. And eventually you'll get it in there once you stir it or shake it up. It will eventually dissolve into that. Okay, now that you have this, you're going to decide what essential oil you want in this. Who can tell me what is myrrh good? It's good for so many things, but what is one of the number one use of myrrh? Myrrh is an anti-inflammatory. It helps with anti-inflammatory problems that you may have. And there are some myrrhs that are food grade where you can put some in your water if you're having any kind of infectious disease or infection from somewhere. Maybe like some of the people that were on the plane, they could put a little myrrh in their water, keep some with it and drink it down if it's the food grade, okay? And so myrrh is great for anti-inflammatory, and it is a well-known oil used in Jerusalem and Israel and those places. But not just for Passover and other places, but they used it in, we know it was one of the oils that were, they took to little baby Jesus, but we also know that it is over there, they use it as one of their top #1 oils is myrrh in Israel and Jerusalem in that area.
It's also a toothpaste.
Yeah, so you find it in a lot of natural toothpaste. Because you can create your own toothpaste, and if you make your powder toothpaste, you can just put some of the oil in your powder toothpaste and brush your teeth, you know? So it's good for so many purposes. Okay, so this one I'm just going to I'm gonna add I need to add a little distilled water to this kind of fan it out. I usually to have little stirrups that you can use to do this. Okay, it's taking long enough. Anyway, when you shake it up vigorously, and then you put you have your little top here you can add on. Put your lid on it, and just shake it and shake it and shake it. And so when you're having pain, whether it's your leg or your knee or whatever, you just roll some of this on, okay? So another quick one, they tell me my time is almost up. So another one you could do is with, if you took the calm, and normally you would measure it out, but I'm just gonna add some to this water. Okay, you see it will have a bubbling effect, you see that? Okay, and then you're gonna add, along with that, you're going to add some of your MSM. It sounds like Alka-Seltzer, you know, how it fizzles, that's what it sounds like. Okay, and I didn't have a spoon, so we're just gonna stir this up real quick, and we're gonna add to this one, I want to feel, I'm gonna put peppermint oil in this one, because peppermint oil is also great for pain, and it also helps to bring the blood circulation to those areas and where you're having the inflammation, and I'll put in myrrh, okay? And then we're going to pour it up. Okay. Put your lid on it. Okay. And you shake it up, and all you have to do is when you're having the pains, you just grab wherever you're having your pain. And it's gonna look like it's got oil in it, but it's magnesium is a form of oil. It has its own built-in oil. So there you go. You have a spray coming up, and when it starts getting cold, take it with you. Use it, and you will be blessed from it. Yeah.
What do you use it for?
You use it for arthritis or any kind of joint or inflammation.
Oh, okay.
And the calm, of course, it helps to restore it helps to give you a lot of energy, and it also is magnesium. It's full of it's cracked with magnesium is what it is. Okay, any questions? I couldn't hear you.
Like muscle release medicine, that stuff that you rub on.
Yeah, but this is more of a natural approach.
I know it's fine.
Yeah, without all the alcohol. Okay, thank you. I'm gonna get a towel.
Okay, and now we have our special lecture for tonight by Dr. Ben Pruitt. He's going to be talking about natural ways of treating peripheral artery disease. Welcome, Dr. Pruitt.
Put this on here. Hello, can you hear me okay? Well, this is my first experience here at a Living Well seminar, so I wasn't sure what to expect. My partner and I have met Pam Adala at various events, and I have a relationship with her, and so we had spoken at one point, and I offered to be able to participate in some kind of environment where we could present something to the public. And she's told me about this seminar, so not knowing much about it, I've prepared something to present to you. I will welcome any questions. There should be some pamphlets going around the room, which I've not created myself. They're from a product rep. I've put my information on the back of one of them. So I did bring some business cards, but the information for our clinic and things on the back if you're interested. It has information in the pamphlet about, particularly bad complication of peripheral arterial disease, and that is where the problem gets bad enough that you might need part of your limb removed. So it's sort of just letting you know that is sort of something that could happen with people that have this disease, and to kind of intervene in it earlier on so it doesn't get to that point. So peripheral arterial disease, I don't know if you've heard of the term peripheral vascular disease or peripheral arterial disease, but this is essentially narrowing of the arteries, limiting blood flow to the extremities, or limiting blood flow anywhere, and it most commonly is symptomatic in the feet, and this can of course be very problematic because if you can't walk around, you might have difficulty doing what you want to do. But it can be worse than that, to where you're developing sores or gangrene or things like that that might require amputation, or could lead to infection or things like that that might result even in death. But in the large majority of the population, it doesn't. People may not even know that they have it. And in truth, people may go their whole life without, even if they have peripheral arterial disease, not becoming symptomatic enough to require any kind of intervention. But there are things that you can do to improve the symptoms, even if you have the disease, and so obviously doing things to improve the symptoms may prevent you from ever needing any kind of treatment. It affects a large number of people, and of course older. This graph here shows you, down here, pointer is this one. So 40 to 49, very few people have it, but as you get older, until you're about 80, the older you get, the more disease you have, and I'll show you what that kind of looks like. But the body deposits either calcified plaques or non-calcified plaques in the arteries, and narrows that down, and can block or just narrow or completely block flow to different parts of your extremities. And I think I have a little picture here that I can show you. A normal artery just looks like a tube, and arteries carry blood from your heart to somewhere in your body. Veins bring it back. So in peripheral arterial disease, you get plaques that form that can calcify, or even just calcifications that will narrow areas like this and this, to where now it's having trouble getting the flow through there and can't even block up the flow. So early diagnosis is important because obviously that can help you, prevent progression of the disease, maybe even reverse the disease, and improve your symptoms before they get significant. The same processes that affect the arteries in the legs or elsewhere in your body also affect the arteries in your heart. So that's another reason. If you notice these kind of symptoms, it would be, or if you know somebody that has them, important to be evaluated for the heart too, because the same processes, if they've got problems in the arteries of their legs, they could have problems in the arteries in the heart. So most people that have it, or many people that have it, don't realize it, or they think it's just part of aging. They might start walking slower, might have a harder time climbing the stairs, might have walk less distance, and they might attribute it to fatigue when in fact they have things like this. Claudication is one of the main symptoms that people experience. Claudication is pain that you experience when you exercise or have activity that is out of the ordinary, that goes away when you rest. So it's typically measured in terms of like feet or blocks, like somebody might say, a doctor might say that you have half a block claudication, meaning that you can only walk half block before you're forced to stop because of things like cramping your buttock region or your calf, most often your calf. Either numbness, tingling, or pain in the foot or calf. And once you rest, it'll go away, but then as soon as you start walking again or walk that distance, then you get the symptoms again. And this is because your body can't get enough blood flow to the area. So other signs are, more progressive signs might be pain that is just disturbing you when you're sleeping, you're not actually active, or even at rest. sores that either heal more slowly or not at all. I would say that other things like diabetes can also contribute to some of these processes here, like numbness and poorly healing wounds, of course, can be related to diabetes. Color changes or like a cooler leg. If you notice a temperature difference, you can maybe realize that you're not getting as much flow to one leg. And then poor nail growth or nail thickening, of course, could be related to like a fungal infection, but you could also have this type of symptom from not having that blood flow. Decreased hair or very shiny legs. And as the disease progresses, and the pamphlet is kind of, got passed out, talks about, avoiding amputation, avoiding that kind of severe or serious complication. Critical limb ischemia, this is, claudication is not limb threatening, it's not something that's gonna require you to get something done right away. It's just inconvenient and limits your lifestyle. Whereas critical limb ischemia, if something's not done to fix the problem with a surgical bypass or opening the artery, this is going to end up resulting in an amputation potentially. And it may be something has to be taken care of in a matter of days, if not, sometimes if there's a really abrupt occlusion, that might need to be taken care of in a matter of hours to avoid the amputation. And it's obviously the very severe end of the spectrum, but it's important to recognize that if somebody has it ahead of time, so you don't end up getting to this point. So if somebody has critical limb ischemia, it's negative prognosis. Amputation rates in 1 year, maybe up to 12%. Overall in their lifetime might be as much as 25%. And people that get partial amputation or part of their limb removed might end up needing more amputation because of poor healing or things like that. And so these can be things that limit your ability to recover and of course, have a high rate of mortality. We talked about this a little bit before. The cause of plaque buildup is unknown in a lot of cases. There's medications that people give and things to kind of reduce the amount of cholesterol, inflammation, improve the blood flow, but so it's a little uncertain exactly why some people get it and other people don't because even though you might have some of the same lab values, some people might get it and some might not, but there are definitely some conditions that raise your chance of developing it, and so then those are things that you would want to avoid. Obviously can't change your age, but you're more likely to get it if you're over 50. The smoking is one of the main things. Smoking, nicotine can constrict the arteries and lead to a lot of problems with your lower extremities and your heart. Diabetes, of course, this causes calcifications that deposit in blood vessels, and over time, the walls get thick and narrow and full of calcium, and so they're not able to accommodate blood flow, and oftentimes just slowing down the flow quite a bit. High blood pressure, this leads to kind of abnormal flow in the artery and irritating it. Cholesterol, we talked about that is often what we attribute those plaques that we show those pictures of getting deposited in the artery, causing those narrows. And then if you had a history or family or personal history of these things, you might be concerned. And then people who are African American descent have a higher risk. But obviously, any of these things you might want to be further evaluated and make sure that you're getting those things taken care of. And so of course, smoking is one of the big ones. Keeping your diabetes, high blood pressure under control, weight loss, and then physical inactivity is really important. As a physician, I would want people to get out there and be a lot more active. And you can ask people to do that. And this is hard to convince people to do, especially if they've already started developing some of the symptoms, because it really requires somebody to have a lot of drive or encouragement, because it is going to be painful. And we talked about claudication being painful when you walk, and so that makes it hard, but actually increasing exercise is enough. Your body will improve the flow. And the recommendation is to be active at least 30 minutes a day. Eat healthy diet of fruits, vegetables, and whole grains, and manage those conditions. So how's it diagnosed? We have physical exam findings, look for the pulses, like we talked about the color, and there's things that we can look at, like how quickly the blood returns to the toenails, and what the nails look like. We talked about the hair on the legs, things like that, if there's any kind of sores. And then there's an ankle brachial test, which is this. They check the blood pressure in the brachial arteries in the arm, and then the one at the ankle, and compare. Is the same kind of blood pressures going to your arm as it is to your leg? And if there's not, there's that difference, then we tell there's some kind of blockage going down towards your leg. And then it can actually use Doppler and listen to what the quality of the artery sounds like. I'm an interventional radiologist, and in radiology we do things with imaging. This is a CT angiogram that you may have heard of. I'm sure you're familiar with CT. An angiogram just means we're looking at the arteries. And they've actually taken this and they've mapped out the vessel, so it looks kind of weird, but they've actually taken the vessel all the way from the belly, the aorta, the big artery, all the way down to the foot. And it's going through this anterior tibial artery and popliteal femoral. So this is the same thing represented in the same patient on a conventional angiogram, which is where we put a tiny catheter in the artery and then take pictures to contrast that. So this person doesn't have much disease. You can see that the arteries are smooth, clean, and there's blood flow in all the branches. Looks normal. And somebody who has peripheral arterial disease, this is somebody who's got pretty significant disease. This person still has blood flow that goes all the way down. It's not actually blocked in those arteries. This is the thigh region, of course. But you can see how irregular and narrow that looks, and you can imagine how that would make it hard for the blood to flow easily down the leg and get to the foot. So, three approaches for treating peripheral arterial disease: lifestyle changes, taking medication, and in more severe cases, you might need special procedures or surgeries. And we're really trying to improve symptoms, improve quality of life and activity, but then also prevent things like the heart attack. You might identify problems in the arteries in the leg. You got to get your heart checked out too. So lifestyle changes, we talked about briefly: increased activity, healthy eating habits, smoking tobacco, cessation, weight loss. And so I noticed the topic, I originally submitted a talk about peripheral arterial disease and trying to think about things that were more specific, like what can we do that's natural treatments. Exercise therapy is a big one. We do talk about this with patients, and we encourage them to, but only some patients are really going to follow through with this. And so there is something called supervised exercise treatment. And so you can actually prescribe somebody to go to a facility where they'll supervise you exercising and monitor that you're actually doing the 30 minutes or however long walking 3 times a week. And even though that seems kind of silly, it's actually very helpful, because otherwise somebody will have the motivation to do that. And just doing that can increase the blood flow. Some of the mechanisms, just walking, any exercise will increase the blood flow, allows the vessels to dilate better, increase your muscle strength and endurance, increases the function and metabolism, just interestingly enough, just your pain tolerance, because you're actually doing it. And it actually will increase, exercise will increase the blood, the creation of new blood vessels, angiogenesis, and reduce your blood viscosity, so that means it'll make your blood less thick. So all these things will contribute to the blood flow being better. So if you know somebody that has any signs and symptoms, and they don't have signs that the limit's critical, but they're just having pain when they walk or something, you can encourage them and say, you need to get up and start walking around, for your heart and for your legs. So this is an example of what we do when we treat it, just to let you know, if we can't obviously treat it with natural means, somebody's got to the point where they need some kind of intervention. We do what's called angioplasty, which is ballooning. This balloon is temporary. We put a wire across the area, balloon inside the vessel. And if the balloon doesn't work, sometimes we have to place a metal scaffold called a stent, and the stent doesn't come out. The stent stays in the body. So this is somebody who has bad disease. You can see that there's not the contrast isn't a straight line. It has gone through some of these collateral vessels, getting around the blockage, and you can see that it's sort of discontinuous. And then getting a wire across, somebody has done what's called atherectomy, which is a device that can grind up the plaque into very, very tiny particles that's small enough to go through the smallest blood vessels. And after doing that, just doing that, it looked a little better than it used a drug-coated balloon. So that's obviously not a natural treatment, but this is one of the things that we do. Other things, these are things that I'm not too familiar with. I think they're investigational, and we'll have to find out if they pan out. But I did find it interesting that pneumatic compression therapy is something being investigated and has promising results. And this is just like those little air boots that you put on, kind of squeeze your leg. And apparently, this is, even though that doesn't seem like it would do that much, it reduces swelling and promotes blood flow and actually improves the gradient so that it's easier for the arterial blood to get down there and venous blood to get back. So that I guess you could view as sort of a natural thing. Sort of interesting. We talked about this reducing your risk briefly. So another thing I looked at was dietary considerations. So antioxidants. You know, I thought this might be interesting to talk about. Like a lot of people talk about eating things that have antioxidant properties, and it's been proven that diets high in antioxidants, like fruits and vegetables, are associated with lower mortality. And this is uncertain exactly why, whether it's due to the antioxidants or other compounds. But so obviously we know that eating lots of fruits and vegetables is healthy. And then a number of these therapies have been evaluated, and they've come out with kind of mixed results. So this is like selecting specific antioxidant molecules, like things like vitamin E and C and things like that. And those haven't really shown that there's a definite benefit alone if you just take the supplements. This one in particular, the bioactive form of vitamin E, alpha-tocopherol. So this inhibits platelet aggregation, prevents interarterial thrombus, but there's like 10 or more forms of vitamin E. So this particular one seems promising, but beta-carotene, vitamin E, C, when they do these tests and they've done just supplementation, they haven't found that those are actually effective for the disease. High doses actually might be a concern. It did show in at least one study that it might make things worse. And for other people, beta-carotene might be dangerous. For people that do vitamin E, if they're on things like warfarin or Coumadin, it might increase your bleeding risk. But for natural sources of vitamin E, this alpha-tocopherol, it mentioned that nuts, leafy greens, seed oils, fortified cereals among the best foods. So when you're doing a dietary, that's a good way to go. What about multivitamins? And so the no effect on cardiovascular disease, they don't find any change in the heart or legs, but it did see a reduction in all-cause mortality for men at least, not necessarily one. That's interesting. Chocolate, I don't know how you feel about chocolate. I thought this was interesting that it was brought up. You know, chocolate, people talk about cocoa being an antioxidant, drinking dark chocolate or cocoa. And there is a study that's ongoing, and we won't know the result of it, but yet until it's kind of panned out. But I thought it was interesting that somebody was studying whether chocolate is going to, we might be able to prescribe chocolate at some point. So, peripheral artery disease is a progressive disease and affects a significant percentage of the population. And earlier lifestyle modification, weight loss, increased activity, healthy eating habits, and smoking cessation are really what we're going for in terms of modifying progression and improving symptoms. And I would say that what would be ideal for our patients, if we could really get patients to increase their activity, I think that would be like the biggest thing that would help them. But that's hard to convince people to do. And then, of course, we call endovascular, that's intervention from inside the artery, is often available prior to getting either amputation or some kind of surgical bypass. So these are some sources. This was off the Stay in Circulation site that the government put out. So this has information about peripheral artery disease. Basically, there's some other information in the pamphlet I had handed out that is from one of the vendors. But the vendor is for, I mentioned atherectomy, the vendor is for the atherectomy device. But do you have any questions? Comments or thoughts? Yeah.
I have a comment. I was reading online the other day that Fresno has the dubious reputation that we have more amputees in this city than any other city in the state of California.
There is a lot, so, and I'm not sure exactly all the reasons, but we have a large population of people here who wait a long time to be treated. And peripheral arterial disease is one of these things that, like I mentioned here, if you can halt the progression of the disease earlier on, you won't end up with the severe symptoms. But many of these people that have some of the earlier signs, they might be developing sores or things like this, they are not seeking treatment until very late in their disease. And so at that point, when the arteries, multiple arteries that are blocked all the way or occluded, or they have a pretty significant infection and things like that, unfortunately, there's only so much that can be done after you reach a certain point. So I don't know if that's part of it. I'm not sure if it's a pattern of practice here. What's that? That's true, but there's other places that have a lot of VA patients, you know. But that is a good point, and that is interesting. It actually doesn't only hold true for arterial disease. There's other things that we find that there's a lot of patients that are just waiting a long time to seek care. We see some very advanced diseases when they come to the hospital, more so than might show up other places in the country. Thanks for your comment. Anybody else have any questions?
Define plaque and cholesterol. Are they one and the same? What is plaque and what is cholesterol?
Well, plaque we refer to as soft or calcified, hard plaque. The cholesterol can be deposited in the plaques, but many times, that might show up as like a soft plaque. There are different forms of cholesterol. Some of them are good and help carry other cholesterol and fats back to the liver. Some of them are thought to end up depositing in these kind of plaques. The plaque itself, like we talked about before, nobody knows exactly why, but it seems to be related to inflammation or irritation. Some people are just more prone to it. And one of the reasons that many people in the country are on what's called a statin medication is to try to reduce inflammation and try to promote these plaques to be reduced over time, recruit that cholesterol out of those plaques. That being said, once they've calcified, that one picture I showed you with all the calcified vessels, that's not going to go away with modifying your cholesterol. Those calcified plaques they're stuck there until we do something about it, either with atherectomy or stenting or something like that. But you can modify other things to prevent more of that from happening, or try to. The plaques themselves, cholesterol itself, in and of itself, does not cause plaque, but it is a component of plaque.
So you cannot have a cholesterol problem and still having plaque.
Mm-hmm. Yeah. That's right. Yeah, in fact, because we refer to things as being plaque, but things like end-stage renal disease, that leads to calcification, depositing in the blood vessels. Diabetes, that also leads to calcification, being deposited vessels. And anytime there's irritation or abnormal flow dynamics, turbulence in the vessel can irritate it. That can release the narrowing eventually.
So then you can probably say inflammation, chronic state of inflammation.
Inflammation.
Unrecognized is going to build up plaque throughout the body.
I wouldn't. No, I don't think that you can say that for sure. But I would say that if you think you're having any of those symptoms that we talked about, then you should be evaluated to find out if that is what's causing the symptoms. If there's some of these things. Excuse me, I got something in my throat. Thank you for your question. That is a common recommendation. So one of the things that we find in arterial disease is that when you have abnormal flow, because of some of these narrowings, you can have injury to the vessel or narrowing. We think that one of the processes is that your platelets get stuck together and lead over time to more narrowing and get deposition in the artery. And so what aspirin does is it does two things. It reduces inflammation. It also prevents platelets from sticking together. And so a lot of times people are put on aspirin for heart disease because it helps prevent platelets from sticking together. And but it also helps in the legs too. And there are other medications that prevent platelets from sticking together that are used. Excuse me. Apologize. I haven't talked about as much. But yes, aspirin is one of the common medications. Beyond the cardiovascular and lower extremity disease.
What's the downside to aspirin? Is it also irritant? Can cause inflammation in certain areas?
So they make enteric-coated aspirin because any NSAID, which is that classification medication, Motrin, ibuprofen, it's the same medication, Aleve, aspirin, if it sits in your stomach, or maybe just that process of processing the drug, it can lead to stomach ulcers, things like that. Some people are prone to the gastric bleeding. Say that again.
It's good to take it along with the meal.
Good to take with milk. Yeah, you want to eat any of those with food, but they make some of these that are protected by coating, like a coating that are helpful too. But the baby aspirin is a smaller dose, of course, the 81 milligrams. Speaking of irritants, I've got a little something. All right. Any other questions?
I don't know if it has to do with what you were talking about. I did see on one of the slides about ischemic something. So my husband a few years ago had ischemic colitis.
Oh, yes.
And I was wondering what caused it
Okay.
and what can help prevent it. Because there was really no follow-up after he got well.
Okay.
And
Well,
we're not even really sure what made him well.
I see. Well, there's really a couple things that, well, the same processes that affect any artery, like we talked about. So you could get ischemic colitis for a couple of different reasons. One of the reasons could be because you develop these plaques that narrow the arteries, and that might lead to chronic ischemia. But if you had an acute ischemia, it could be because, for instance, people that have irregular heart rhythms, like atrial fibrillation, they can develop thrombus in the heart that can, if it gets dislodged, it might plug up an artery somewhere. So that can lead to an acute ischemia at different places. I mean, it could go to the brain, it could go to the limb, but if it goes to the vessels that go to the gut, the bowel, then mesenteric ischemia. Mesenteric is things that are related to the bowel. And so if you have something like that, then it can cause acute ischemia. But interestingly enough, there are areas of the colon and the bowel that have an overlapping blood supply but are not very well supplied. So if you have a very low blood pressure, or you aren't pumping as much as well with your heart or something, you can get ischemic colitis just because you're not pushing enough blood there, even if you don't have those kind of narrowings. So that may have been something that happened to him.
Well, what preceded him getting sick was a flight home from China, which was, and he did not get up, this is a period of months. He did not, or a drive on, he did not get up and walk around on that super, super long flight.
That's definitely a risk for blood clots, but those are typically clots in the veins rather than the arteries. So I'm not sure if that would have contributed to that or not. If he was diagnosed with that and then it went away, I mean, he may have.
He was in the hospital for 8 days.
Okay. Yeah, I'm not sure how they diagnosed it, but is it possible that it was infectious? I'm not sure. But those are some of the reasons. For people that have chronic ischemia, we do sometimes see those patients and place stents in the artery going to the bowel. Or retreat. There was a patient that I saw in the hospital who threw a thrombus from her heart that we went and aspirated. One of the things we talk about here, it's not really relevant to the more chronic process, but there is a devices that are available to us where we can actually suck blood clots out of the artery. And that's what we did for a patient. So. Good question. Any other questions?
What about hyperbaric oxygen treatments?
So hyperbaric oxygen treatments are, so hyperbaric means increased pressure, and these are typically used in a wound care setting. And what they do is they will force oxygen into the tissues because of high pressure in the chamber. And it's something that's commonly used in like in a wound care setting. But I haven't used them myself because I don't work with wound care, but that's typically what I use.
Okay, if there are no other questions, let's give Dr. Pruitt a round of applause. Thank you so much, Dr. Pruitt, for being here. Thank you for coming and sharing with us.
No, you're welcome.
All right, come back again, please. All right, at the back, we have a table of cookbooks for sale and also some of Deborah's special natural remedies. We have cookbooks that are designed by nurses, dietitians, and doctors to help us to prevent diseases and also to reverse diseases. Okay, and now we have our gift session. We have some giveaways. Did everyone fill out that red card in the back? Everyone got one? Okay. Okay, very good. All right, let's have our drawing. Tell us your name, please. Alana, thank you for being here. What number do you have? Marilyn Christensen. All right, our first receiver. Come on down, please. Next. Jean Sanchez. Are these people here? Okay, come on down quickly. How many gifts do we have to give away? Oh, we have 2 so far. Alrighty. Congratulations. Mary Nicholas, come on down. Jill Webb. All right, come on down. And I think we have one more. Terry Yamamoto. Is there anyone by that name? Okay, very good. Okay, we have 2 more gifts. 3 actually. We have Lynn Makayama. Come on down. One more. We want to thank Deborah for making these, donating these to you guys tonight. And we have Lydia Holmes. Come on down. And we have one last. Elisa, I won't attempt the last name. Elisa, come on down, girl. And the last shall be first. Okay, anyone have any questions tonight? Did you guys enjoy yourselves tonight? Very good. Give yourselves a round of applause. We want to thank all our cooks tonight, all of those that presented, Deborah and Sikori, thank you for making this possible. And thank you guys. We could not do this without you. So thank you for being here tonight. Shall we close out with a word of prayer? Our gracious Father in heaven, thank you for every man and every woman and every child that's here tonight. You care about each one of them. You desire each one of us to be in health, because you came that we may have life and that we may have it more abundantly. So bless each one tonight and provide for their every need, whatever they may be. In Jesus' name we pray. Amen. Have a good night, everybody. Don't forget our table. We have wonderful items for sale tonight. Thank you.
The treatment related to the arteries, the one that you're referring to relates to the vein. The treatment of the vein